are here today to talk about some non-surgical options for body contouring. And the question is not only what they are, but do they really work? So, did you want to talk about cellulite first?
Well, yeah, I think that cellulite is a tough one, and it's very hard to get reliable treatments. One thing, I can't really call it non-surgical, but in just the right person, if you use a technology called cellulase, which is somewhat minimally invasive. It's a laser that you put under the skin, but it's a directional laser, so you can turn it up, you can turn it sideways, you can turn it down.
So how is it working to destroy the cellulite?
So basically there's three things going on with cellulite. Number one is you've got, the skin is actually thinner over the area. Number two, you've got these little tethering bands that run from deep to under the skin. And number three, you have lumpy fat. So if you can pop this under the skin, turn it down, buff down the fat, turn it sideways, cut the bands, turn it up, and paint the undersurface of the skin. It will thicken the skin. And in just the right patient, it'll work great. Now, who's that patient, of course?
That's the question, because like everybody wants to be that patient,
right?
But how many people are really that right patient?
Somebody with really good, tight skin. Once the skin is loose, I don't offer it. And I think certain zones, the back of the thigh is probably the home run. But that's an area that bothers people, not the banana roll, which is that little curve right under the buttock, but that lower portion. If you get somebody with good skin tone and kind of an intermediate level of cellulite, it'll help. Will it completely get rid of it? No, but I mean, it's pretty significant.
I agree with some of your points, but I've had some success with a different device called Selfina. As opposed to using a laser, what that does, it's called the subcision technique. It involves numbing the area and then using a very special needle it comes with the device to just cut that band to relieve the cellulite.
But don't you think even with Selfina, it's more of an issue of patient selection?
Oh, absolutely. It's a very difficult problem to treat, a very common one, but in certain patients, also ones that have very good skin quality and very well-defined dimpling in the back of the thigh or the buttock, Selfina does work. But what I tell my patients is it's not going to make them 100% better. They'll see improvement, but it's not perfect.
So what do you think really would work for most people?
There are some injectables that people are working with that may be coming down the road, but I would put a big red flag of caution on that, because there have been, cellulite has had so many claims, and most of them end up disappointing people.
So what that means is we have some options to treat cellulite and improve the appearance in the right patient, but a lot of us may not be that right patient. So it's really important to talk to our surgeon and our doctor to get an understanding of what is possible. Is that fair?
100%.
Yeah, I agree completely.